I have a question about continuity of care. What if there's a system failure and the system's down for 2, 3, maybe half a day? How do you take care of when all the data is on the servers and you can't access it? What happens to the care to the patient at the bedside or at the surgery or in ICU when vital information is needed to have to continue care of that patient? Has there been discussion of that?
I can just briefly say that we have a whole department that looks at business continuity. We have downtime procedures. It is printing out forms, it's faxing. It's the way we used to do it before it was, online. And I know that there's also things are stored. And I'm not technologically savvy, but we do have the ability to retrieve data if we need to look back at things. Luckily on downtime procedures, you're truly go into more of an emergency mode, so you're not able to access everything all the time. But when we do have a group that can go in and retrieve data, and like I said, we actually print forms and go back to paper, and things go on. We have the ability to do that. By printing, we can print it out.
I would add to that, of course, measures can be taken to try to make your systems more reliable and more redundant, but we know we've got to take those systems down sometime. We've done things like we have a read-only medical record offline. It's hosted by somebody else, so it's not in our facility. If we have a complete failure, at least if we can get to the internet, and this is where those personal devices may become important, because hopefully if, as they say, the fiber-seeking backhoe gets your connection, you could go wireless. And we've deployed at a lot of sites, about 25 sites, and they're using an AT&T type connection, which is subject to failure. So we've struggled with what's the backup for that. In some cases, it could be a laptop with a card in it, or a case of laptops with cards in them that we might dispatch out to a location for a primary care situation. In the hospital, we're just trying to build double and triple redundancy to assure that the outage windows are as short as possible. And we're in the midst of standing up a co-location site with redundant paths and all those kind of things that you can do, but there still is the opportunity. But what I think we can do is minimize the time. If we can take the window from hopefully ever being days down to hours, then we've mitigated a lot of the risk that you're referencing. That information that's gathered while the system's down is one of my great concerns, and the downtime procedure should capture that. But everybody's so busy getting that data back in the system. My fear is there's going to be a gap right there. So we do the best we can at that point, but I think your concern is significant.
I would just add, from the human side of that conversation or the challenge of downtime, my background and my specialty is nursing informatics, and my colleagues struggle with that a lot in terms of preparing staff for the moment when it occurs. Back in the day, we had paper forms, and when we automated, the nurses would hide those paper forms just because it was their security blanket, so to speak, that they could go back to that. And the average age of nurses is now 49, so there are a lot of us like that. But the new crop of nurses coming in are very tech savvy. They're wanting to go to organizations that have the EMR systems implemented, and so they're not used to the paper way of working. So when you give them the downtime opportunity, so to speak, they don't even know how to deal with paper. So it's a big challenge for education as well, to make sure they're prepared to deal with that backup component. And then I think there was another comment on this, but when we're done with this question, I would encourage you to speak up about best practices or successful projects you've had in your organization, because I think the purpose of today is just for the sharing. So we're not the experts here, you guys are as well. So please feel free to add your thoughts.
I'd like to add one more angle to that. We seem to respond to your question from the acute care delivery point, but the recent weather-related tornadoes in the southeast will very easily teach us lessons about the home care and the personal medicine issues that are coming up when the Walgreens and the CVS are not able to communicate and you're not able to refill your prescriptions. So there are similar alternative paths that Michael was talking about, and everybody is out there is planning for and doing. But I think that, again, looking at the systems, we need to share our knowledge so those who are not up there yet will be able to implement solutions.